Hey there, workout freaks! When exercising, we often forget that our muscles pay a price if we're not careful. For example, have you ever hurt your shoulder? It kills! While exercise is often the culprit, there are plenty of other causes. Let's discuss 6 causes of your shoulder pain. For the sake of keeping this list interesting, we won't be counting the obvious ones like fractures and injuries. Rather, things that are a little more unexpected. From a bad liver to a heart attack. We're talking all that and more. Let's begin, shall we? Number 1. Arthritis. This painful disease impacts your joints, normally causing pain and stiffness around the affected area. If said area happens to be your shoulder, you're about to be put through the ringer. Shoulder pain is often a product of rheumatoid or osteoarthritis. What's the difference? Osteoarthritis happens when the protective cartilage around your bones wears out, causing severe pain in your hands, knees, hips, spine, and shoulders. Osteoarthritis is the most common form of arthritis, with nearly 33 million Americans suffering from the disease. Rheumatoid arthritis, on the other hand, causes inflammation of the joints, resulting in damage around other parts of the body. This includes skin, eyes, lungs, heart, and blood vessels. In the case of your shoulder, rheumatoid arthritis occurs from an autoimmune disorder that targets the lining of your shoulder joint. The pain usually transfers to the other side of the body. If you suffer from arthritis and your shoulder is in pain, you should consult a medical professional. Arthritis could be the issue. Number 2. Angina. Arthritis does bite, but shoulder pain brought on by this condition suggests something much more frightening. While the term may be new to you, this coronary artery disease serves as a warning sign to underlying heart problems. In fact, angina is the most common CAD out there, with an estimated 10 million Americans suffering from it. Angina is the discomfort you feel when your heart muscle isn't receiving enough oxygen-rich blood. Your arteries then experience a buildup in plaque, causing them to narrow. As a result, pain is felt in the chest region. It can also extend out to the neck, back, jaw, and shoulders. The 2 main types of angina are stable and unstable. Stable angina lasts around 2 months and usually occurs during times of stress. This puts pressure on your heart, causing all types of strains on your muscles. This is why your shoulder often hurts during this time. Stable angina can be treated with some well-needed rest. Your doctor can also prescribe you medication to relax your arteries. Unstable angina, on the other hand, is much more unpredictable, with pain often settling in while a person is asleep. This happens when the heart isn't getting enough oxygen and serves as a warning sign of an oncoming heart attack. If you feel like this is the case, consult a doctor ASAP. Are you finding this list interesting so far? This next one's also a doozy. Let's dig a little deeper. But before we continue, are you concerned about the overall state of your health? Check out our video on signs your body is lacking in vitamin E. Also, if you just can't shake that hankering for junk food, cheer up! Click on our clip discussing 9 guilty pleasure foods that are actually good for you. Don't forget to click that like button, subscribe to our channel, and ring that notification bell for more great Bestie content. Now back to our list of 6 causes of your shoulder pain. Number 3. Frozen shoulder. Another funny sounding condition. No, it's not what you think. Frozen shoulder occurs as a result of tissue buildup in the joints, also known as adhesive capsulitis. It's characterized by stiffness and pain, much like arthritis. Over time, you'll find it difficult just to move your arm. There are normally 3 stages to frozen shoulder. 1. Freezing stage, where the tissue begins to build up, causing your shoulder to become tense. 2. Frozen stage, where you feel less pain but your arm becomes harder to move. Number 3. Thawing stage, where your shoulder finally loosens up and becomes easier to move. This all happens within the span of 1 to 3 years. While the exact causes behind frozen shoulder are unclear, experts state it normally happens after a person's shoulder has been immobilized for an extended period of time, usually after an injury or surgery. Number 4. Bursitis. Again, don't feel bad if you're unfamiliar with this one. I had to look it up myself. Bursitis affects the fluid-filled sacs known as the bursae. These work as cushion for your tendons, joints, and bones. When the sacs become inflamed, you experience pain in places around your hips, wrists, knees, and elbows. But the most excruciating pain of all will be felt when you try and move your shoulder. This condition normally sets in after your muscles repeat the same function over and over. In order to treat bursitis, experts recommend that you rest your shoulder and try to avoid physically demanding work. If all goes according to plan, your symptoms should be gone within a few weeks. Before we continue, we would like to thank Pure Gum for sponsoring this video. Pure gum is the leader of sugar and aspartame-free gums and mints, with a great taste that doesn't hold back in flavor. Pure gum is sold in 25 different countries around the globe. Pure gum. Live pure. Number 5. Bad liver. This pick probably caught you off guard. I'll admit, it involves a little bit of deception. When suffering from liver damage, your right shoulder will feel as if it's hurting. In reality, the pain from your liver begins in the upper right area of the abdomen. From there, it travels up the body, causing your back to ache. Because the pain is often overwhelming, it's hard to figure out the exact location it's stemming from. As a result, you might mistake it for pain in your shoulders, kidneys, or general abdominals. This is what's known as referred pain. You think there's something wrong with a certain part of your body, when really, it's another place entirely. While your shoulder may not be in trouble, a much more serious matter may be at hand. If you discover it's liver pain you're experiencing, don't hesitate to seek medical advice. It could be early signs of hepatitis, liver failure, or possible tumors. Number 6. Impingement. This is another common cause of your shoulder pain. Impingement occurs when the tendons or bursa get pinched within your shoulder bones. This causes your shoulder muscles to swell up. This is caused by repeated activity, oftentimes one that requires you to reach over your head. These include painting, swimming, weightlifting, and basketball. If impingement is what you have, you'll notice that motions like reaching overhead or behind your back have become more difficult. This will make crucial activities harder, such as putting on clothes and accessing contents on shelves. If your impingement goes untreated for an extended period of time, tendinitis can take place. This is where your rotator cuff's tendons become inflamed. If you aren't careful, it will eventually tear. If you're looking to treat your impingement, we do not recommend stretching, as your condition may worsen. One thing you can do is take it easy. Medicine, such as aspirin, might relieve the pain. However, any meds should be taken under doctor's supervision. Number 7. Spinal injury. Alright, I know we said we weren't talking about injuries, but this one's not normally one you'd associate with shoulder pain. Believe it or not, it is common to feel tension in the shoulder after injury to the spinal cord. As a matter of fact, around 75% of those with SCI report some form of shoulder pain later on in life. Here's why. If a person no longer has the use of their legs, their upper body has to work twice as hard. You now rely solely on this part of the body to complete tasks usually meant for your legs. While you will build strength in your shoulders, the overuse of your arms will cause stress to the muscles. If you happen to be in this position, it will be nearly impossible to completely stop using your shoulders. Instead, the best thing you can hope for is to minimize their use. This means to take breaks whenever you can. If someone is able to help you, ask them for assistance. If you have to do a physically demanding task, do it with efficiency. This way you won't have to try again. Do you often experience shoulder pain? Do any of these causes apply to you? Let us know in the comments below. We would love to hear from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video, and enjoy.